Hello everyone, I am Maryam Kalatehjari. I graduated from Isfahan University of Medical Sciences in 2020. I'm an obstetrician and gynecologist. First of all, I would like to thank you all for giving me the opportunity of sharing a part of my research regarding cervical cancer and common diagnostic and screening methods. The title of my study is The Values of Colposcopy in Patients with the Diagnosis of the High-Grade Squamous Intraepithelial Lesion in Routine Papa Nicolau Test. As you know, cervical cancer is one of the most preventable malignancies that can be diagnosed in the early stages through a screening test. Turning to the risk factors, the following can be mentioned. Number one is HPV infection or human papillomavirus, regarded the most important factor. Then there is immune system deficiency. The third factor is smoking. Age is number 4. To give more explanation, I should say that if the first intercourse occurs under 60, risk increases. Number 5 refers to low socioeconomic condition. The next one is having multiple sexual partners and also having given birth to 3 or more children. And the last one is using birth control pills for a long time, 5 or more. Let's introduce Colocan. Colocan is an international agency for research on cancer. According to the Colocan, cervical cancer ranks as the fourth most common cause of cancer incidence and mortality worldwide. Chart shows that cervical cancer comes after breast, colorectal, and lung cancer, which causes around over 600,000 women worldwide. Age standardized incidence rate and age standardized mortality rate are known as the ASRR and ASMR indexes, which are reported by Colocan. According to the ASRR, the figure of cervical cancer is 13.1 per 100,000 women worldwide. And also, according to the ASMR, the figure of cervical cancer is 6.9 per 100,000 women worldwide. As we have already noticed, the highest ASMR has reached to 30 to 42 in some parts of Africa. Let's talk about the mission of WHO. This organization is planning to reduce the ASMR to less than 4 per 100,000 women through following steps. Number 1 is vaccinating 90% of our girls against HPV by the age of 15. Number 2 is screening 70% of women twice in the range of 35 to 45. And the last one is treating at least 90% of all precancerous lesions detected during a screening test. Now let's take a look at the guidelines of the American Society for Colposcopy and Cervical Pathology, ASCCP. This society recommended having one of the following screening methods: HPV test alone every 5 years, HPV and PAP or co-testing every 5 years, and PAP test every 3 years. What this study is focusing on to calculate diagnostic values of colposcopy through the analysis and comparison of the result of the 3 common methods, which are pap smear, colposcopy, and biopsy. Before focusing on colposcopy, let's have a brief review at pap smear, the most common screening method for diagnosis of cervical cancer. Pap smear is a simple, fairly reliable, and economical method without any sort of complication. This method has a considerable role in regular examination. In order to increase reliability of abnormal findings in pap smear, biopsy might be essential. To conduct an accurate colposcopy test, which is the focus of this study, an experienced gynecologist is to diagnose any abnormality of the cervix. Colposcopy helps finding precancerous and cancerous lesions, which are visible as the change of color and vascular pattern of the cervix, vagina, and vulva. By magnifying the image taken by colposcope after washing the cervix with acetic acid 5%. To give more explanation about the usage of acetic acid, I should say that acetic acid washes away mucus and allows abnormal area to be seen more easily with the colposcope. If the cervical epithelium contains an abnormal amount of cellular protein, the acetic acid coagulates the proteins, which makes the concerned area of cervix opaque and white. a normal epithelium. This coagulated area is called acetylite lesion, or AWL among specialists. Here we have some white area called thin acetylite lesion under effect of applying acetic acid. The result of histopathology is LSIL, which stands for low-grade squamous intraepithelial lesion. Next slide shows a thicker acetylite lesion on the concerned area of the cervix compared to the previous slide. The histopathology is HSIL, showing high-grade squamous intraepithelial lesion. The following three slides taken by Colposcopy show a higher grade of malignancy in the cervix with the SCC result of histopathology. In this slide, we see abnormal vascular pattern with bizarre shape as a result of SCC. Next slide shows coarse mosaic in the background of a dense acetylite area. And the last one is gross tumor in the posterior lip of the cervix. In this slide, main indication of colposcopy are pointed out. The first one is evaluation of women with anabnormal pulp test to localize and map out the extent of the lesion and select those sites, which is the same of our study. The first one is assessment of women with positive result for high-risk HPV. As you know, two subspecies of 16 and 18 are found in half of the cervical cancer cases. The next ones are women who had suspicious appearing cervix, persistent abnormal vaginal discharge, postcoital or postmenopausal bleeding. And the last one is post-treatment of. We are going to look at the gold standard of diagnosis cervical cancer called biopsy. Any abnormal finding in either colposcopy or pap smear has to be confirmed by the histologic assessment. In biopsy, small pieces of tissue taken from cervix and then sent to pathology laboratory for more assessment. Next part of the presentation is related to materials and method of our study. We conducted a cross-sectional study on 94 women who were referred to oncology clinic of the HT due to their abnormal pap smear, high-grade squamous intraepithelial lesion. This study was done between December 2016 and December 2018. What's done for all patients is as follows: gynecological examination, pap smear, colposcopy, and cervical biopsy. The final main step of the study is to compare colposcopy and biopsy, and as you might know, biopsy has a significant role in determining the final result. Now let's turn to the result and discussion. The finding of this study includes demographic information, cytology, colposcopy, and histologic results, test comparison, and values of colposcopy. It should be noted that time has a significant role in such diagnostic method, since the required time for the progression of precancerous lesion to incurable malignancy can clarify the necessity of using an appropriate method with the highest accuracy to make an on-time definite diagnosis. The first part of result is related to demographic information. As you can see, the first variable is age. The average age of participant is 41. The second one, age at marriage. As you can see, it was 20. And number of births, it was 2.7 per participant. And the last variable is contraceptive percentages. We see over 70% of participants didn't use any contraceptive method, and only 5% of the remaining 30% use oral contraception. The second section of results shows cytology finding of pap smear. As you can see, cytology findings are subcategorized under four main classes: normal, osseous and LSIL, HSIL, invasive SCC, and adenocarcinoma. It's noteworthy that only 25 of patients had HSIL result, although the initial pap smear of all were HSIL. And this is in line with the other studies in the literature showing the pap smear as the most popular screening method is not reliable enough to make the diagnosis and further therapeutic approach. The third section, the colposcopy results, as you can see, colposcopy of 22 of patients was normal. 38 showed clean acetobite lesion, 26 showed thick acetobite lesion, and only 8 showed suspicion for invasion. Although a higher percentage of AWL was expected, 22 patients showed normal results. And again, this can be due to the fact that pap smear is not reliable enough. The fourth section of results is the gold standard of cervical cancer diagnosis, which is histologic results. To our amazement, 51 of patients had normal histologic results, though they had initially been reported as HSIL. Here we have comparison between colposcopy and histologic results. This table gives a detailed comparison between those findings. This concordance is 21 normal cases, 7 thin acetobite lesion, 12 thick acetobite lesion, 2 suspicious for invasion for both colposcopy and histology. And the couple coefficient index was 0.247. Our finding represented that colposcopy was in statistical concordance with the finding from biopsies. And finally, total values of colposcopy. In general, the colposcopy study of the cervix presented that notable sensitivity of 97% and specificity of 41%. And we also found 58% for positive predictive value and 95% for negative predictive value. To give more details about the aforementioned colposcopic result, it should be pointed that the accuracy of colposcopy examination was good for all types of histologic results, but we have not found any significant capacity for colposcopy in the third class, which is CIN2, CIN3, and carcinoma in situ. As you can see, the highest sensitivity was detected for normal diagnosis, followed by cancerous lesion, and then thin acetobite lesion. And the highest specificity was detected for thin acetobite lesion, followed by cancerous lesion, and then normal diagnosis. Let's turn to the literature review of the study. Here is a report of some studies carried out in Queensland, Iran, Vietnam, and Romania to measure colposcopy value. The following studies were conducted on patients with abnormal pap smear. As you can see, in 2010, Margaret McAdam reported a sensitivity of 99% and a specificity of 77% for colposcopy tests, performed on 206 patients in Queensland. The 2018 study conducted in Vietnam performed by Naviga Boy gives the result of 88% for sensitivity and 43% for specificity. The study is performed on 87 patients. In Iran, 2019, the study was performed by Saeed Ahmedi on 350 patients. Sensitivity and specificity rates were around 90%. And finally, the study of 2022 in Romania gives sensitivity and specificity of 80% on 128 patients. This study was conducted by Liana Plus. Remarkable differences among the studies about the ability of colposcopy to detect non-benign cervical lesion may be attributed to the operator skill, quality of colposcopy performance and interpretation, and finally, the precise classification of the lesion. Now I'm going to present final conclusion of my studies through the following table. Here we have colposcopy finding in terms of sensitivity and specificity. The results are highly significant for normal CIN1 cancerous lesion cases and non-significant for CIN2, 3, and carcinoma in situ. And therefore, further evaluation are recommended for the non-significant class. Limitation of our study was lack of data regarding HPV infection and vaccination status of patients. And finally, I want to share with you this take-home message. Colposcopy remains an essential tool for the diagnosis of premalignant cervical lesion, particularly when limited resources make HPV detection unavailable. Finally, I would like to thank all the researchers, care providers, and patient participants who contributed in this study. This study has been conducted under supervision of my professor in the oncology clinic of the Hospital in Gynecology Department of Isfahan Isfahan University of Medical Sciences. This is a photo of a very memorable day in my life, study session from which I got today presented results. Thanks for your attention.